Hi guys, it's Ms. Palmer again, talking about one of your fundamental skills, which is restraints. There are several different types of restraints. Today, the only restraint we're going to talk about is your soft wrist restraint, often called your 2-point restraint, because it's going to restrain the patient's upper extremities. So the first thing you need to know about restraints is it's our last resort. So we've tried every other thing that we can think of and nothing else is working. We've tried distraction, we've tried moving the patient, we've tried giving them something to do to occupy them, and none of that is working. So now we have to utilize a soft wrist restraint. Ideally, it would be best if you had an order for that from the provider prior to placement. However, it doesn't always work that way. In this particular case, Ms. Jones here keeps trying to pull out her NG tube. So we want to make sure that we keep that NG tube intact, so we're going to go ahead and we're going to place the soft wrist restraint. Again, ideally you have this order ahead of time, but depending on the policy and facility you work for, you may have to apply it without an order and then get that order hopefully within an hour. So first thing you want to do, of course, we're always going to go through our fundamental pieces of introducing ourselves, so our AIDIT, washing our hands, making sure we have all our safety pieces. But in this case, it might be a little bit tricky because the patient may be combative or not really cooperative. So you're going to look at it in terms of the safety of the patient. Well, what I need to do is I need to get it on the patient with some explanation of why I'm putting it on the patient. So I would tell her, Miss Jones, you keep pulling this tube out, and this tube is here to help you. And so I'm just going to put this restraint on your wrist here to help to remind you not to keep grabbing at that tube that's at your nose there, because I know it's uncomfortable for you. So we're going to go ahead and we're going to take the Velcro here. It has a Velcro piece. That Velcro piece needs to be pointing this way so that your little hook here points towards you and away from the patient. So we're going to look at her extremity very quickly, check for CMS, circulation looks good, movement looks good, and sensation looks good. And that's always to give you a baseline understanding of the patient before you apply the restraint. So now we can put it on. When you Velcro this piece, you need to make sure, and this is a little loose because she's a mannequin, but you need to make sure you can fit 2 fingers between the patient and the restraint. I'm just going to put the side rail down here. If I can find a little latch. Okay, so then I said the hook needs to be pointing away from the patient, so you're going to take this first sort of loop ring here, and you're going to hook it on that. You don't want to hook it on these 2 because these 2 are going to be how we're going to secure the patient to the bed piece. So it always goes on the first hook. So securing to the bed. So in your procedure skills checklist, it says not to secure to a movable part. So let me explain what this means. The bottom of the bed will move up as you raise the person's legs. Whoops, that's the head. Did that last time. So you can see here, it's moving. We don't want to secure it down here. Moving, moving, moving. Same thing with the top of the bed. It will move as well. In addition to that, underneath the bed will be a piece that will move the bed up and down. So you always want to look for the piece that does not move. In this case, it's this small little portion right here. So it does not move. It's a non-movable part. And that's where you're going to actually thread this through. Before you thread it through, you need to secure it on the patient's wrist. And this is something that we can practice in lab too, because it's kind of tricky out here. it doesn't go traditionally like a belt would, because that will, as the person maybe fights a little bit, that will create like a tourniquet, and it will get tighter and tighter. So instead, we're going to loop through the ring that's furthest away from us first, and then we're going to come back through and thread through that second ring. So let me do that one more time for you. Hi.
Oops. Now she's gonna have to edit that.
No. So through this ring back here, and back through the second one. And that's going to allow it to be stable enough that when the patient moves their arms, it's not going to pull tight. So then we're going to come down here to tie the actual release knot. So you can either tie it around here, or there's a small hole you can actually put it through there. That's fine either way. But remember, cannot be tied to any movable part of the bed, and that includes the bed frame itself underneath. So to do a single, and I'm going to show you double, but to do a single, you're going to make a loop, and we're going to call this piece the patient, because that's what the patient's attached to. And then this piece I call the tail, just because it's what's left over. So you're going to make a loop, and you're going to go around the patient and through this hole right here with the whole loop. So one more time, you're going to make a loop, you're going to go around the patient and through this hole right here with the whole piece. Okay, nice and tight. You're going to pull the patient and your loop. Nice and tight. But we know that if this patient were trying to get that out, eventually that patient would pull it right open. So in order to make sure it's really secure and our patient doesn't pull out their NG tube in this case, we're going to make our single. Remember, that's a loop around the patient and through the hole. And then this tail down here that I called, make that loop real small, by the way. We're going to reach in and we're going to grab this tail. And when we grab this tail, we don't want to pull it all the way through. If we pull it all the way through, we're going to have a big knot. And that's not quick release at all. All we want to do is just pull it through just a little bit. And then we've got another quick release. Now, oh, that patient can really move, and they're not going to get out of that. But if there was a fire, we can quickly release that. So again, remember, don't pull that tail all the way through, or you're going to have just a knotted up mess. That's the hardest piece for people to get. So finally, you have to make sure that you're assessing your patient. So we have to make sure that we're looking at the patient's extremities every 30 minutes. We're going to be checking for CMS, skin integrity. So we're going to be looking at the patient's skin for any bruising or redness. And then every 2 hours, the patient needs to be released. And that means actually taking the patient out of the restraint, letting them do some range of motion. If they needed to go to the bathroom or needed anything to drink at this time, that's what we would go ahead and offer to them. Only for a few minutes. It doesn't have to be hours, but every 2 hours that has to be completed. Thank you.